as you know, we have a lot of patients that come in that want their teeth taken out, and they don't understand the repercussions of what will happen if they do have their tooth taken out. Of course, we promote a Nampa Smile saving teeth, and that's the best protocol and best way to handle treatment. So in this particular case, I have my patient Augie again, and she's come in and wants an extraction, and there's just no talking her out of it. The doctor has left and given both options, as we do in our office, because you know, we want to give patients options. So the first option is to save the tooth with doing a root canal buildup and crown, or the second option would be to remove the tooth, and that would relieve her pain. I have talked to Augie just briefly on the cost of both of them, but I'm going to go into a little more detail now that the doctor has left the room. So Augie, you know, Dr. Justman explained that tooth has a really big cavity and it is savable, or we can take it out, whatever you'd prefer. Which way are you kind of leaning towards?
Well, it's my very back tooth, and I'm just kind of wondering if I even really need it to chew with, and so...
You know, that's a valid question. When your teeth come together in chewing ability, it becomes an issue because those back teeth are really the ones that are chewing against each other. When you have two teeth that are, you know, biting together and chewing, if you remove one, there is nothing to chew on against there. Now you have your other teeth in front, which can be chewed just fine. But what will happen long term is this top tooth will have a tendency to grow down and super erupt because there's not a tooth there stopping it. And so eventually you may lose this tooth on top if you take out a bottom tooth because there's just nothing there for it to stop at. Another thing that can happen if you do remove a tooth versus save the tooth and keep it in your mouth is teeth will shift. So say you have a tooth in the middle of two teeth and you choose to take that tooth out, these teeth can shift and close in on that area, causing a lot of misalignment with your bite and your chewing. So while the option of taking out a tooth seems to be, you know, really good at the moment because you get you out of pain and, you know, you'll just have a quick healing time, long term it can have some major effects on your biting and chewing abilities. Versus saving a tooth, we keep the tooth in there. There's no shifting of the teeth and there's no problems with any chewing. And now I know the cost is a big difference. It is. But you do have insurance to help you out with it. Even if we were to do just the root canal buildup today, your out-of-pocket expense would be right around, you know, $200. And to me, you know, if it was me, I would save my tooth, especially if I just had that little bit of patient portion to pay. Taking out the tooth is still going to be less expensive, but you're going to encounter lots of those other issues down the road. As far as replacing a tooth once we've taken it out, there are options for that, but then you're going to even jump to a higher cost. So it'd be, if you're thinking about replacing the area, it definitely would be probably more cost effective to just save the tooth overall. What other questions do you have?
Well, yeah, I'm thinking that maybe I do, you know, want to save that tooth because I don't want to affect my other teeth. But I just kind of heard a lot of bad stories about root canals, and I'm just worried that it might be more painful than taking it out.
No, very valid. You know, every patient's different and every tooth is different. Sometimes when you have been having pain on a tooth, it can be tender for a while, and you know, we recommend ibuprofen and things like that. But it's definitely less traumatic on you and your tooth to do a root canal versus taking out the tooth. I've been in a lot of appointments where it looks like the tooth will be an easy one to get out, and then it really isn't. And it can be very traumatic and very painful to take out a tooth. So a lot of times it's easiest to do the root canal. I have a little video that I want you to watch, and I can kind of explain the process of a root canal because it is something new and you've never had one before. But it's a very, you know, I looked at the x-rays and your roots are very straight, and it'll be relatively routine root canal. With root canal, sometimes there is tenderness after the appointment, but nothing that could be handled with some ibuprofen.
Okay.
So yeah, I definitely think saving the tooth is going to be the best option, especially where you've got the insurance to help you out, and it's, you know, a couple $100 and you get to save your tooth versus take it out and deal with consequences later on. So, any other questions?
No, I don't think so.
Okay, great. Well, we do have time to do the root canal today, so I'll let Doctor know.
Okay.
Okay. So as you can see, when you are trying to explain the advantages and disadvantages of different treatment options, you really have got to be educating the patient and really being at their level, being eye level, talking to them and communicating instead of standing behind and looking at the computer screen. That means you've got to feel confident in yourself that you can present this treatment in a way that they will accept it. And we've got scripts to help you with that, and as long as there's repetition in the things that you say, then we're confident that you will come across as being able to explain and educate patients. So thanks for watching the video.